All right, today we're going to lay out our roadmap for managing type 2 diabetes. And our guide for this whole journey, it's a single, really powerful number, the A1c. So let's just dive right in.
I mean, think about that for a second. What if just one number could tell the whole story of your health, not just for today, but for the last 3 months? Not just a snapshot, but the whole movie. Well, that number's real, and it's the key to taking control.
And that number is called your hemoglobin A1c, or you'll hear it called HbA1c. It's the gold standard, because it's not thrown off by what you had for breakfast this morning. It actually measures how much sugar has been sticking to your red blood cells, giving you and your doctor this amazing big picture view. It really is like your diabetes report card.
All right, so what's this report card really telling us? Let's break down how this one little number helps guide your entire treatment plan from start to finish.
So how often do you need to get this checked? Well, it really depends on where you're at in your journey. If you and your doctor are trying out new medications or you're just not quite at your goal yet, you'll probably get it checked every 3 months. But once you get into a good rhythm and you're hitting your target consistently, checking in every 6 months is usually plenty. It's all about making smart, timely adjustments. Okay, let's start at the beginning. Level 1. This is for an A1c between 6.5% and 7.5%. You can think of this as the phase where you are building a super strong foundation for your health for years to come.
And the cornerstone of that foundation, no matter what your A1c is always going to be lifestyle. This isn't just some casual suggestion. It is the most critical part of the entire plan. So let's look at what that actually means.
First up, weight loss. And we're not talking about some dramatic, impossible goal here. For people who are overweight, losing just 5 to 10% of their body weight can make a massive difference in how well their body uses insulin. It's a really meaningful goal.
And then, of course, there's movement. The goal to shoot for is at least 150 minutes of activity, like a brisk walk, spread out over the week. That's a clear, totally achievable target that pays off in huge ways for your health.
And if you're wondering just how powerful this stuff is, get this. For people with pre-diabetes, making these kinds of lifestyle changes can slash their risk of progressing to full-blown diabetes by a staggering 58%. That's more than half, just from these foundational steps. It's incredible.
But hey, let's be real. Even when you're doing everything right, sometimes lifestyle just needs a partner. And in that case, metformin is the trusted, gold standard first medication. It doesn't replace what you're doing, it works right alongside you to help you get to your goals. Okay, so what happens if those lifestyle changes and metformin just aren't quite cutting it? Well, that brings us to level 2. If your A1c is hanging out in that 7.6% to 8.5% range, it's probably time to intensify things by adding a second medication to the mix.
Now, this is where things get really interesting, because choosing that second medication isn't just a random pick. It's super strategic. It's not one size fits all. You see, if you have heart or kidney issues, something called an SGLT2 inhibitor might be the best choice. If weight loss is a big goal for you, a GLP-1 agonist is often a fantastic option. And hey, if you're worried about side effects or cost, there are these great, well-tolerated drugs called DPP-4 inhibitors. The main takeaway here is that the choice is tailored specifically to your health profile.
All right, let's talk about level 3. When an A1c gets over 8.6%, we're moving into a phase that really calls for some more advanced support to get that blood sugar back into a safer range.
This is typically when we start talking about injectable therapies. These are really powerful options, like those GLP-1 agonists we mentioned, or something called basal insulin. They're brought in because you need a more aggressive level of control to bring these higher numbers down safely and effectively.
And listen, when that A1c number climbs above 10%, the language from the medical community gets very, very serious. This is no longer just about adjusting a plan. It's about, and I'm quoting here, urgent and comprehensive intervention. That's a really critical line in the sand.
The response here has to be methodical and fast. We're talking about starting insulin right away, checking for any immediate complications, probably getting a referral to a specialist, and this is so important, bringing in a whole team of people, like educators and dietitians for intensive support. It's truly an all-hands-on-deck situation.
So we've walked through all these levels and numbers, right? But now we get to what is maybe the single most important idea in all of this. Your target number is unique. It's not one size fits all. The golden rule here is, and always should be, patient-centered care. Just take a look at this tale of 2 targets. It shows you exactly what I mean. For a younger person who is just diagnosed and is otherwise healthy, a really strict target, say under 6.5%, might be perfect.
But for an older person who has a bunch of other health problems, a more relaxed target, maybe even up to 8.5%, could actually be much safer, because the top priority is preventing dangerously low blood sugar. So you see, the right number is completely dependent on the person.
And that really brings us to the big picture here, playing the long game. Because at the end of the day, this journey is about so much more than just hitting a number on a lab report.
So, what are the keys to really succeeding in the long run? Well, it all starts with you. You're the key player. And by staying on top of things, working with your whole care team, you're actively protecting your heart and your overall health. And all of it, is done for one reason: to protect your quality of life. That's the real goal.
So please, remember this. The A1c is your roadmap. It's an incredible guide that helps you navigate and stay on course. But it is not the final destination. The true destination is a long, healthy, and fulfilling life.
So I'm going to leave you with this one question to think about, and maybe even to bring to your doctor. Is your diabetes roadmap built just for you? Because a plan that's personalized is the most powerful plan there is.